Friends, if you are athletic or involved in any kind of sports or physical activities and you've been hurt, or you're dealing with an injury or an issue, stay tuned because today's episode is going to be very valuable for you. Welcome, I'm Barry Napier. I'm here with Dr. Angela Yegley.
Yes, hello.
Sage Health TV, where you can tune in for all kinds of great stuff, health related. Today we're talking about PRP and athletes. So maybe, since everybody knows what an athlete is, but maybe everybody doesn't know what PRP is, why don't you tell us a little bit about what is PRP?
Okay. So PRP is platelet-rich plasma. So it is actually the part of your blood, your platelets being pulled out of your blood, activated to do all kinds of cool things in the body when we inject them. So, yeah.
So essentially supercharging your kind of your body's healing regenerative characteristics.
Yes, yeah. So it is definitely, PRP is in the regenerative medicine category of treatments. So meaning that whenever we use it, we can take PRP and pretty much put it almost into any space. You just, the only thing you can't do is do IV, but you can inject it really anywhere.
What about into a spinal cord?
You can do, well, we wouldn't do that, but you can
do it though.
You can pretty much put it anywhere.
But that's it's like some places where it needs to go can be very specialized.
Yeah, absolutely.
But what we find is that you can use it for muscle, you can use it for skin, for underlying stuff, for joints, right?
Yes.
There's so from a how it can be used quite broadly for a lot of regenerative benefits.
Yes.
So one of the things in naturopathic medicine I like to think about is that different treatments are kind of like different superheroes. So if you're a Marvel fan, if you're familiar in any Marvel characters, if you know Wolverine, who has incredible regenerative powers,
right.
PRP is like Wolverine power. That's what it's going to give you.
I love
kind of. Not quite as awesome as Wolverine.
I love it.
So your bullet shot won't self-close and spit the bullet out like Wolverine style. But it really is, that's what it's there. You can think of it as it speeds up the regenerative and the healing process.
Yeah, absolutely. So again, if there's a tear, right? If there is, even repair from surgery, if there is joint pain, if there is degenerative, some sort of degenerative arthritis pain, like you can take that PRP and we can put it around either into the joint, around the tendon, into the muscles. So we're looking at tendonitis, we're looking at bursitis, we're looking at, again, all the tears, the strains and sprains. We're looking at, again, arthritis type pain too.
And we also use it in cosmetic treatments. So
we both had it. Yeah, injected into.
If you've ever wondered, well, how are they so attractive all the time?
It's PRP.
PRP.
Yeah.
PRP, friends.
Fountain of youth.
Yeah.
Right.
Yeah. Secrets out. So one of the things I think that's interesting is when you talk about regenerative medicine, a lot of times people will talk about or think about stem cells.
Yeah.
So you hear this a lot, stem cells, because they got really buzzed, a lot of hype around stem cells.
Yeah, absolutely.
And you don't hear as many times people talking about PRP in that same sentence.
Right.
So why don't we do a little bit of, versus comparison?
Yeah. So what's really interesting is that, there are different types of stem cells. There's amniotic stem cell, there's your own stem cells that are pulled from fat or bone marrow, and then there's also live stem cells. Now, in the U.S., no one is allowed to do live stem cells. So if you're going to have them, you have to go to another country. You have to go to Mexico. Panama is a big one. So here in the U.S., either it's pulled from your body through your fat or your bone marrow, amniotic, which is from a placenta, right? So cool studies looking at comparisons of basically your activated platelets, the PRP, compared to treatment with the different types of stem cells. And what's really cool is that in most of the studies, long term, the PRP basically did as well long term in the health of wherever you injected it as the stem cells. Now, why that's cool, I think, is that PRP is so much more available because it's your own blood.
It's more available. It's more affordable, so it fits into a broader range of budgets. Yeah. For a stem cell, live stem cell, but besides travel costs of going to another country or whatever, those can be quite significant in terms of cash investments in those treatments.
Yeah.
PRP is a much more accessible yet highly effective treatment that can produce some very powerful healing results in the body.
Absolutely. We're talking about low, 1,000 to stem cell thousands, a minimum of 10.
Huge factor difference. This is $1,000. This is $20,000. I mean, like that kind of a range between treatments,
so much
but
more accessible.
not that kind of a range necessarily in results, which is it's not like the wine world, you know. It's like, this is a $150 bottle. How much better is it than the $60 bottle? I have to tell you, friends, it's not that much better.
Right. All right. There you go.
So in terms of what PRP actually does in the body, we've talked about it kind of from a, you know, an analogy standpoint, Wolverine power, but what does it do from a biological standpoint?
So PRP actually increases something we call growth factors, which is exactly what stem cells do, right? So I'll just mention the growth factors. So like TGF beta 1, VEGF, insulin growth factor, IGF-1. You're probably going to, you know, if you're reading about PRP, you're going to read about those. And those are all that, like, what's really cool is wherever you inject PRP, it will adapt to that tissue and push the growth of those cells, right, in a positive, healthy way. So there have been no studies linking like growth of any abnormal tissue, which I think is important to note. Just thought about that. So say if you're injected in the face, right, you're going to improve collagen and basically the cells that improve, like, you know,
it won't
oil
start like
production.
growing like an arm out of your, like a little hand starts growing out of your face.
Or if you inject it into the hair, right, you start growing hair. So very effective treatment for women and men. Put into a joint, starts regenerating collagen and many times even like repairing bone, things like that. So put it into muscle tissue, it's going to start significantly repairing muscle tissue, you know, or the tendon.
Could it be used as a part of a growth strategy if you were, say, like looking to grow muscle mass more intentionally?
You know, I would say probably it's limited enough that unless you were maybe just one of those people that you're like, every day I'm going to come back, have a bunch of my blood pulled out. And we're going to be hardcore. We're going to inject it every day somewhere in my body.
Into your bicep, just this one bicep. I want it to be huge.
Right. So probably not. Okay. But great question. Okay. Great question. But area that you want to improve the healing of, like, say maybe you have like a chronic bicipital tendonitis, something like that, and you're like, well, it keeps coming and going, so that might be an area that would benefit from a couple treatments of PRP, even if you're not like acutely like, oh man, this is the time I'm in pain. You can still do it then, but if you're like, this is my trouble area and it's always flaring and it's always having a problem.
Or like we've mentioned, if you've had surgery, or if you have an operation, or you've received treatment number of time for a chronic condition like that, this can be something that can actually produce quite impressive healing results. So there's some studies you wanted to talk about that kind of demonstrate some of that.
So first one was just an overall review of like looking at muscle strain, right? Tear in the muscle. And what they found was really cool, that basically in the studies all the studies that were reviewed, the athletes were able to have a significant improvement in their return play time. So like the amount of time that it took to get back to performance level was significantly shortened compared to people who didn't have PRP and just did the standard PT or, you know, the treatment protocol, right?
Yeah, I mean, and this is relevant for me because just recently, in the last 2 weeks, I had good tear here, partial tear in my pec muscle. And so we're going to be utilizing PRP now that we know what we're dealing with as a muscle tear in that healing recovery. So I'll have more to report back on this topic.
Definitely check out the podcast. A lot of times we do updates on this stuff.
Updates.
Like that.
You'll find the update on the podcast.
So then another study was basically looking at hamstring, strains, grade 2. So it's pretty significant enough to keep you out of playing. And what they found is the same thing, significant decrease in the return to time to go back to play. And what I thought was really cool about this study is that they're actually in the treatment group that received PRP, again, compared to standard treatment, they had a longer term, lower recurrence rate of injury. So meaning the PRP actually benefited them in that area long term compared to people who maybe injured their hamstring and just did PT and, ice cold, the contrast hydrotherapy, things like that. So I love
super
that.
Cool.
Yeah. So, because of course that's once you've, we all know that's depending on what you do. Like if you tear something significantly, the likelihood of tearing it in the future is going to be a little higher, right? So to bring that risk down, I think that's fantastic.
That's fantastic.
Yeah.
So when we look at PRP, why don't we talk a little bit about what treatment looks like and kind of what a treatment protocol would look like many things. In our world, we're looking usually at a series of treatments
Right.
to really produce the optimum effect that we want, not typically a one-time thing. So why don't we just walk through maybe how we go about it, what that treatment protocol might look like, so that people have a better idea.
So optimally, I like people to have like IV vitamin therapy before they do it. It is not a must, right? It's not an absolute that you have to do it that way. However, if we think about, we're nourishing the blood, right? So we're giving a lot of B vitamins and minerals and vitamin C, which is a connective tissue healer. Like we're nourishing the body before, and nourishing those platelets, right? Before we pull out your blood and then, use it to treat a certain area. So ideally we do that. I like to have at least 2 vitamin IVs under, in the couple of weeks prior before doing it. That's ideal. But again, you don't have to absolutely do this. So that's just optimal. So then say having PRP. So at a minimum, you're avoiding Advil or ibuprofen or something like that. That's a blood thinner. 48 hours before you actually have PRP. There are some places, some studies that'll say 2 weeks. That might be a little much, but if you say you're thinking about it, and you've got the time, just go ahead and avoid it for 2 weeks. That's great. So off Advil before you come in and get your blood, because it's going to thin out those platelets, right? So then you come in, essentially schedule a blood draw with us. We take about 6 vials of blood. And then then you can leave, because we need like an hour and a half to kind of prep the blood, and maybe not that long, but just when staff is busy, we just like to give ourselves some wiggle room, and then come back in. Usually we don't numb with PRP, and so a lot of people are like, ooh, getting a big injection without numbing. However, in the research, like when you take a numbing agent, at least when you're injecting it in at the same time as PRP, it lessens the effect of PRP overall. So we tend not to do it if somebody is really concerned about pain with injections, even though it's, it can be a little tender because this is a thick fluid, but people do really, really well. It's just at the moment it's a little tender. We can always do some topical that's, for the injection, a topical numbing agent.
Yeah, that's what I was going to ask. I was going to say, what about topical?
Oh, yeah, we can totally do topical.
Okay.
Yeah. And then we inject, and then you rest the area at least for 48 hours is ideal. So you don't leave and go work out. So that's something you'll have to, because what we're looking for, it's going to create an inflammatory response, so for you here, inflammatory response, because all of those growth factors are going to that space to start repairing, right? Start doing super repair, right? I'm really bringing in and encouraging all the cells that happen when we have like a healing event is what we would call it. So that's what it encourages. So
sounds pretty straightforward.
It's pretty, yeah. I mean, and the injection is fast. It's simple. I mean, sometimes the hair is a little more. I mean, obviously, we're not talking. It's not a hair PRP, but that one takes a little longer because you have to do little injections kind of all across. But pretty much everything else, as far as like strains or a joint, it's like just 1 or a few injections and you're good to go.
And then generally, how many treatment protocol? It probably depends a little bit on what the injury looks like, how a person responds.
Yeah, it does. So most of the studies involve 2. So we usually want to do 2, ideally. I do have people who just do 1 and they're like, I feel great. Mm-hmm. Like, I feel great. I think I'm good. Like, I don't know that I need to come back for a second one. But if we're dealing, most times, most of the protocols are 2. And ideally we do it probably, depending on the injury and how acute it is and what we're trying to push healing of. Will depend on kind of like our time that we repeat that second one. So it would be somewhere between 2 to 4 weeks after we'd want to do it again. So for injury.
Excellent.
Yeah.
Excellent.
Yeah.
Thank you for sharing. Yeah. PRP is an incredible tool in that healing toolkit that you should really think about. And we'll have more follow-up on this as I get to talk a little bit personally about it in the future around how I thought the experience went from a healing standpoint in terms of a muscle tear. But thanks so much.
Yeah, absolutely.
Appreciate you being here.
Yeah. Thank you for being here.
Thank you. And thank you for being here.
Thank you.
And we'll catch you on the next one.
Sounds good. Bye.